Hello and welcome to Giving Ventures, a podcast to help you grow your giving and change the world for the better. Each episode, we share innovative charitable efforts leveraging private philanthropy to solve public problems. I'm your host, Peter Lipset, Vice President at DonorsTrust. This show is a product of DonorsTrust, the oldest and largest donor-advised fund focused on helping conservative and libertarian donors of all capacities simplify, protect, and grow their giving. My colleagues and I talk with a lot of groups doing great work. This show lets us share a bit of what we learned with you, so you can discover new projects for your own philanthropy. In my lifetime, I can think of only one real free market healthcare reform, which was the advent of health savings accounts. As great as those are, they continue to operate with one hand tied behind their back in so many ways. The Affordable Care Act failed to improve healthcare outcomes, but conservative voices failed to win over any takers for a counterproposal, when they had a proposal to offer. Many people are either frustrated by the healthcare ecosystem and overwhelmed by its complexity, or they are largely oblivious to it, allowing the status quo to continue. So what, if anything, will give us a more free, transparent, and outcome-driven healthcare apparatus in America? Our system is meant to be a free market system, but is it? What is the role of doctors in all this? Can things really change? Well, today we're going to explore these ideas and ask the question of how can we ever really get to a free market healthcare system? My guests today are from two new think tanks, the Paragon Institute and Cicero Institute, as well as the unique Benjamin Rush Institute, which works to connect liberty-minded med school students. I hope in talking with them, we can find some new ideas, some new ways of speaking about these issues, and perhaps some hope that we can get to a better spot in our nation's healthcare. Let's find out. Our first guest today is well-versed in the ins and outs of healthcare policy, from both inside and outside the policy-making gates. Brian Blase founded Paragon Health Institute in 2021 with the aim of improving healthcare and lowering prices by empowering patients, expanding competition in the market, and increasing innovation, which we always love. But Brian, you had a really unique seat in the healthcare policy discussions because you were on President Trump's National Economic Council from 2017 to 2019. What did you learn from being inside the walls there, as it were, about attempting to advance free market policy?
Thanks for having me on, Peter. It was the honor of my life to serve in the White House for the first 2.5 years of the Trump administration. My issue was front and center right away. We were working with Congress to try to repeal and replace Obamacare. It became pretty clear to me that the party was not unified on what direction that would take, and that we had not done a lot of the work that really needed to be done in advance to prep members of Congress and prep the public for what that reform was going to look like. So in part, I learned that the Republican Party and those of us who support free markets and limited government, we need to spend a lot more time developing health policy solutions. And a lot of conservatives and libertarians that go into public policy, they go into energy deregulation, they want to reform the tax code. And healthcare is super important and an area where if you care about the fiscal future of the country, right, the health entitlement programs are what are driving our deficits and debt to record level, as well as, just relatively poor outcomes with these programs. I learned that the executive branch has enormous power, and it really has become much more powerful than the legislative branch over the past few decades. Generally, I think that's a bad thing, but it is just a fact right now of political life that the executive branch has amassed enormous power, in part because Congress has delegated a lot of key decisions and authorities to the executive branch. So being able to work within the bureaucracy and advance policy reforms is really important. We were able to accomplish some market-based reforms on healthcare in the Trump administration. We expanded options for workers and small businesses. We enacted price transparency rules so that people know prices in advance of receiving care. We were able to make some pretty significant reforms to the Medicare program. But fundamentally, there's a lot of work left to be done on health reform. Republicans, free market advocates are going to be in charge of government again at some point, and we really need to have a better, well thought out platform for what reforms we're going to advance.
Yeah, and so knowing that there will be another bite at that apple and the overdue window is going to shift again, you came out of the administration and started Paragon. So tell us about the mission there.
Paragon's focus is, I'd say, twofold. One, really evaluating how government programs are working. I think a lot of times the media, the public focus on the intentions behind government programs and don't really look at how they work, the way that they change individuals' incentives. So we want to evaluate how government programs are actually working. And the second thing we want to do is develop a set of reforms that are really based on putting the patient in charge, maximizing their choices, ensuring that there's robust competition in the market, and really creating a regulatory climate that is conducive to innovation. There's a great quote from Harvard business professor Regina Hertzlinger that choice supports competition, competition fuels innovation, and innovation is the only way to make things better and cheaper. That really motivates a lot of my work. Like, what can we do in healthcare to reduce government regulation and sort of bad policies to expand consumer choice, promote market competition, and make sure that we're allowing innovators and entrepreneurs to deliver healthcare more efficiently and more effectively to American patients.
Well, I think that makes a lot of sense to try to assess where we are, right? I mean, as a main pillar to actually get a reality-based view of the landscape. I mean, for example, I've heard you say before how we spend so much on healthcare every year as individuals, as a government, as a society, but America should be getting healthier, and yet they're not. So maybe that's a good place to start. Like, are there lessons we can take away from that, from your research, that and some solutions that you can apply?
Yeah, I mean, let's just think, this is not too much in the past, but just think about the Affordable Care Act. So the emphasis of the Affordable Care Act was expanding health insurance coverage. Now, largely that occurred through a significant expansion of the Medicaid program. That happened in 2014. Well, what do we know population health outcomes from 2014? We actually know that before the pandemic in 2019, American life expectancy was lower than it was in 2013. So we had a huge expansion of health insurance coverage, huge expansion of government spending on healthcare, and American life expectancy declined. Right? We know that there were sort of bad things during that period, like the opioid epidemic. We know that over the past decade or two, rising obesity levels has been a real problem, and one of the conditions that exacerbated people's negative health effects from the pandemic was if they were obese, if they had chronic health conditions, that there's ultimately a lot more that affects our health and well-being outside of medical care. And we have so much focused on medical care, subsidizing and regulating medical care, and not paying enough attention to things that actually matter for health. And a lot of government policies actually worsen sort of things that actually matter for health and well-being, like social connection, like good diet, good exercise, family togetherness, things that really do matter for our health and well-being, but are sort of outside of traditional health policy.
Well, and it seems so much of this comes back to incentives, right? I mean, you've got providers, you've got the government, you've got consumers like you and me and everyone listening here who consume health, if you will. So does your work, does some of the research that you're doing, does it begin to do some work to align those incentives and the different stakeholders so that we can actually start to lower costs and see increased output or outcomes?
Yeah, Peter, it's all about incentives. So I used to teach out an economics textbook that the first two words of that textbook were incentives matter. And then the next sentence was, and the rest is just commentary. So you have to look at how policy affects individuals' incentives. What do we know is a defining feature of American healthcare? It's that people are not spending their own money directly on the care that they receive. The vast majority of spending goes through third-party payers. It goes through government. It goes through bureaucracies, insurance companies, and employers. That people just don't have control over the spending. And then they don't have incentives to be cost-conscious consumers. A lot of health insurance is really the prepayment of medical care. It's not the protection against major financial risk. So I think we have to look at incentives, and we have to look at the policies that allow people more control over their expenditures, that help them to be good consumers, both buying health coverage as well as buying health care. So efforts around price transparency, I think, are important along those dimensions. And what we can do to remove a lot of the unnecessary regulation and bureaucracy that's in between the patient and the medical provider. Like, we don't want the medical provider to be focused on maximizing their income against a whole bunch of reimbursement methodologies created by the government, right? The government is not well positioned to determine value. And in healthcare, we have a big bureaucracy that decides what's reimbursed through the Medicare program and how much the prices through the Medicare program are going to be. When you have big bureaucracies with that much power, you're allocating resources through lobbying, and which special interest groups have the power to block competition rather than sort of allowing market-based mechanism, prices, consumer choice to determine how to allocate resources. So what can we do to better align incentives so that patients have more control over the money, the information that they need, and that doctors are actually serving patients rather than government bureaucracies?
But anytime you talk about change, of course, you get awful messaging. I mean, we're recording this right as the election cycle wraps up. Democrat candidates have been trying to pummel GOP candidates with this. They're going to take away your Medicare message as one of the things in their arsenal. But that's not unique to this year. I mean, anytime change gets talked about, these scare messages pop up. So kind of as we wrap up here, is there a way to talk about the need for change to some of these healthcare entitlements without just flat out losing on the issue?
I think so. I mean, we need to focus on the fact that we want a patient-centered healthcare system, and like what I said on that the bureaucracy has too much power. You are right that whenever there are changes proposed, you get a lot of opposition to those changes. Many times that opposition is driven by industry that is benefiting from the way that the status quo is set up and doesn't want to subject healthcare to sort of the creative destruction that you have through the rest of the economy. We know that that creative destruction is what leads to better, more efficient products over time. In part, it's going to take leadership, though, Peter. Like, there's got to be leadership that lays out the real problem with these programs, both in terms of the budget trajectory that they're on and in terms of the poor outcomes that many enrollees on these programs receive. I mean, if you look at the U.S. fiscal position, and we're serious about engaging in policy reform, the deficits are unsustainable. And if we don't make changes to our spending, and our spending problems are driven by our entitlement programs, our standard of living in this country is going to be lower over time, and we're going to face a situation where the next generation, for the first time ever, is not as well off as the previous generation. And these reforms, I mean, they will take some political leadership, and ideally you want to insulate people on the program now from any fundamental changes to the program, but to restructure it so that it serves younger Americans and future generations better than the way that they're serving us now.
It'll take courage on all sides. Well, Brian Blase, we're glad you and Paragon are out there trying to propose some solutions and get us into a better spot. Appreciate you being here.
Hey, thanks so much, Peter.